sigcwele, iskem sami siphelele, cela ningithelele, noma yisavana nyana, izingane zigcwele, iskem sami siphelele, cela ningithelele, noma yisavana nyana. Akasafuna ukumula, akafuna ukulala, awungephatha uzolala lana. Akafuna ukumula, akafuna ukulala, awungephatha uzolala lana.
Ubedansa phezu kwetafula lapha e-Alexandra, ayinambona lona ngizomashkarana. Ubedansa phezu kwetafula lapha e-Alexandra, ayinambona lona ngizomashkarana. uNkulunkulu asithethelele, asiyeke sidalele, nababona labantwana benza amawalawala. uNkulunkulu asithethelele, asiyeke sidalele, nababona labantwana benza amawalawala.
If you are standing, it's a good teacher. Dama. Right, we will wait a bit for those that are standing, that are still arranging our chairs, and we will total wait for silence. Guys, we would like to begin. Bayanda, right, okay, guys, once we have settled, I would like us to begin. We are already a few minutes late. We were supposed to start it exactly at 11:30. So as soon as you are settled and you are quiet, we may begin, or we will begin. Okay. Right, okay. Before we commence with our program, I think it's only fitting to perhaps give a little introduction and background as to why you are here today. So let me start by doing that first before we start with our first speaker. But I will do that once everyone is seated. Again, it's okay, everyone is seated. Thank you. Right, okay guys, we're starting. Today, we as the family of ANTON LEMBEDE Maths and Science Academy, together with our very distinguished guests, are gathered today to have, or to rather to commemorate Mental Health Awareness Month, which commenced on the 1st of October in the present month. As we engage on all the issues that can and do affect us in the spheres of our well-being, we are to take with us all the proposed advice of how we can guard ourselves against being victims of this overwhelming society and how we can assist one another in obtaining a healthy state of mind despite all the calamities and challenges that we face every day. Today, ANTON LEMBEDE students, this event is mainly for you. You are going to be writing exams the week after next. So the main thing is to prepare you for the exams, but also at the same time to talk about issues that affect you directly and indirectly. Issues of substance abuse, issues of mental health illnesses. So that is why today we've decided to take this day off from our very busy revision schedules to have this day, because this day is as equally as important as the exam that you will be writing. There's no point in you writing an exam, but you know you are not in a healthy state of mind. That will ultimately filtrate into your performance. So we've decided to take this day to have this session. So we will be very grateful if you will bear with us. Please be quiet and please cooperate when necessary. Right, okay. Thank you. I would like us to all stand, and maybe all stand, guys, all of us.
very, I don't know, very unhappy and dull, and like you need to exercise a bit. I don't know, maybe jump around, open your mouth, exercise your jaws. You've been too quiet. Maybe it's time to, just sitting there passively. Guys, yes, I know, mental health awareness. Maybe that's why, but guys, we got this. We can overcome it. Sometimes it's just the attitude. So if we can just stretch out a little bit, maybe hold the hand of the person standing next to you, look at them and tell them, you know what, my friend, we got this. Tell them that no matter what, next week when I act, I have got this. Guys, thank you. May we sit down a bit. May we sit down a bit. Let us please welcome Dr. Lube, psychiatrist. She's just walked in. May we please give her a hearty round of applause. Doctor today. We all are. We appreciate her taking a time out to join us today. Doctor, we welcome you. Our headmaster, who is going to be doing the opening and welcome for us. May we please be round of applause.
Yes. Thank you for coming today. Cool things. Or perhaps maybe can have a look at what we're doing today. Okay.
Thank you very much, Dr. Director. I'm sorry to tamper with the program, but I'm requesting that we open with the prayer and prayer with the empowerment of the prayer. Let's all stand and sing the prayer.
No, I don't know. It's not here.
Thank you very much. You may be seated. Okay, thank you very much, Program Director. Allow me to not waste time. Mine is to greet all of you. Let me greet and welcome the following guests and supporters of this institution. I'm told that amongst us there are officials from the District Office of KZN Department of Health. I've also been informed that we have Sindisweni Hospital officials. There is also Cloud Therapy. There is Indwedwe Clinic. There is Phoenix Community Health Center. There is Inanda, not Inanda, it's Siatutuga FM, no Nanda FM, it's not Inanda, it's Nanda FM and Kama TV. Let me greet all of you from your different departments and organizations, and thank all of you for responding positively to our call, and also thank all of you for having shown the love for an African child. For those of you who are joining us for the first time, this is ANTON LEMBEDE MST Academy. It's an institution that started its operations in 2021. It's a co-ed institution, as you can see. We have both ladies and gentlemen who are students in the academy, but it is a focus school that only focuses in math, science and technology. So all our students are boarding inside the institution, which on its own, it comes with a number of challenges, and amongst those challenges are issues of mental health awareness. It gives us pleasure to celebrate this very important month with yourselves, as we all agree that mental health is not only for a certain section of the society, but all of us, we need to be supported in terms of our mental state. I need to inform you that it is even worse in our case, because these students are high achievers. If you can see their results, you will understand what I mean. All of them seated amongst us are very highly intelligent young men and women. So as such, I always debate this when I meet with other officials of the department, that if you afford a special school, a school for students with learning disabilities, because you say that is a special school, also a school that is formed for highly gifted students is a special school. The difference is what is special about those students. So it is indeed very critical, and it is for us a very important day and a very important event that our students are going to be supported in their mental state, so that as they are going to be starting with the end of the term assessment, they are ready mentally as well as physically. I also want to address you, ladies and gentlemen, to say, please utilize this event to the best of your abilities. Make sure that you don't look at the second person. You know what you need as an individual. So the colleagues who are here to support you, make sure that you utilize their availability so that whatever that you need support on, because this is about your own life and this is your own journey. So there is no one who must account for your own journey except yourself. So good luck to all of you. May we have a successful event. But again, as I said, I want to thank all the colleagues who have joined us. Also thanking the colleagues from our academic and non-academic staff members who organized this event. Thank you very much, Dr. Director.
Thank you.
Thank you very much to our principal. May we please stand up
Once again, there was an error of omission. May we please stand up once again? We are very blessed to have two more doctors, professional psychiatrists with us. We only mentioned one, but there are other two that are here. Dr. Mieza and his wife. May we give him and his wife a hearty round of applause. May you please come to the front. Sir and ma'am, may you please come to the front. Sir and ma'am, may you please come to the front. We also have Dr. Inda Jeet with us as well. May she also get a hearty round of applause as she comes to the front. Thank you very much for being with us today. Thank you very much, guys. You may sit down. Thank you. Once again, thank you to our principal for your explicit and warm welcome of our guests. We hope that they feel welcome from now until the lapse of this meeting. Let us move on to the purpose of the day. Purpose of the day. Why are we here? What are we here for? Right? Remember, everything must have a purpose. Just like the principal said, your life needs to have direction, it needs to have purpose. If you're a writer, I always tell you what, an essay needs to have a purpose. Anything written, purpose. Anything must have a purpose. Everything and anything always has a purpose. So our event today also has a purpose. So purpose of the day, may we have Mr. N.K. Kumano to do the purpose of the day for us. Thank you. Sir.
Sanibona. Ninjani? Kambe angithi kusesikoleni la? Angithi niyafunda? Lezo indaba angithi ukuze uphase kufanele incwadi zakho uyivule uyifunda ngithi ngoba mawungayifundi wo angithi abazali bakulethile ngenhloso yokuthi uzofunda yingakho ukube ngangiwumculi ngangiyothi noma ungayivula noma ungayivala kulele uzothi wethukile, whatever. No, guys. We are just here to say to you, to them, to whoever, okhona lana, we are celebrating, noma we are doing usuku esilibiza ngokuthi i-Mental Health Awareness Day. Okay. What we need to remember is that, number one, worldwide, October is a mental health month. Okay? Bese kuthi umhla 10 October is the World Mental Health Day. Bese kuthi umhla 20 October, it's a Down Syndrome Day. So Down syndrome is part of mental health. So as we are here as different hospitals, different clinics, and the district office, doctors, nurses, psychologists, we are all here because we want to assist you, give you information on different illnesses that can come to you. Okay? So it's important that you must know that today we came to you to give you the information and help you to be aware that there are illnesses which are mentally related. But it differs here which illness it is, which symptoms do you have, how many, because before I say you have a certain illness, I have to make sure that you meet the criteria for that illness. Like for example, if you say you are antisocial, we need to say what do we mean by that. If you say you are hyperactive, we have to clarify. So it's important that we come to you, we give you all the information that we can, and we also empower you, because more especially as you are here, you are all on your own, parents are at home, it's just you, the books, the teachers, isn't it? So now we have to make sure that we empower you so that you will be able to stand on your own and make sure that you do not collapse, you do not die, you do not develop problems again. Okay? So, ushilo wati ngwakakhumali sibongo ngokwemfundo bese ngiba i-child and adolescent mental health specialist. Amphinde futhi child and adolescent. Yes, so I specialize in mental health. So which means whatever you want to know about mental health, you will come to that corner there on the left hand side. I'll give you all the information. I'm not alone, there are doctors with me, there are nurses with me, there are psychologists with me. So which means now you will get all the information that you want to get. Okay. Ask and ask and ask again. Okay. Alright. Ngicela abayithu abafaka amajezi yazi, abayithu abagqokile amajezi bamela phambi kwami. Abayithu abagqoka amajezi. Just two. Alright. Oyedwa ngicela mengala, oyedwa mengala. Ngifuna ukubona ukuthi kuyenzeka yini. I want a winner between the two, ne? Awubani amajaji inini, angithi? Oh, okay. This one is Team Bani, linjani lo mbala lo? Team Red, lona Team Bani. Akesibone ukuthi ubani wina, aswafuthe bese siyawabopha phezulu, then I will tell you which one do you do. Okay. Again, you better besa wafutha, ne? Mamelani ke ngixoxela nengane niyazazi ingane kwani? Oh. Okay. Ngelinye ilanga kwakhona inja, ne? Niyayazi inja? One day there was a dog with 12 puppies, ne? And somehow by mistake inja yashayiswa imoto and died. And then the 12 puppies were left without umawabo. And everyone was saying, oh, shame to those puppies, they will die, because it's cold. And then they were making the noises, and then as time goes on, they noticed abantu ukuthi umsindo wezinja wehla waphela. And then they said, Hayibo, so quickly they are dead. Hayibo, let's go and see. When they went to see ukuthi why abantwana bengasakhali, this is what they noted. Can I have laba baphambi bebe laphambi kwami? Ozami. Imanini la. Okay, I guess omunye. Okay, what's. Okay, angithi niyababona. Okay, awuhlete ngo. Awuhlete ima, hlekana wena ngala. Okay, uyabona ukuthi phakathi kwabo kukhona ama-spaces angithi? Lama spaces enza kungene amakhaza, enza kungene ama-problems, enza kungene whatever, because now Lona has been separated from the family yakhe. There is no mother, there is no father to take care of each and every one of you. Ngicela nisondele nihagane lo bayi-4. Just go closer. Just go closer, guys. Okay. You know, in cases like this, what is going to happen is that ukufudumala kwakho is going to be transferred to another one. Nokufudumala komunye is going to be transferred to another one. And mangabe nizobambana kanje, akekho ozobulawa amakhaza, akekho ozobulawa isizungu ukuthi angikho ekhaya, ngoba ukhona ubhuti wami, ukhona usisi wami ungibambile ukuze ngingabi namakhaza, ngingabi nama-problems. Ngitho umuntu engikhuluma naye in the absence of my parents, my family members. So what is important? When they saw all puppies belele kanje, omunye ubambe omunye, omunye ubambe omunye, they said, wow, what's a good thing that the puppies are doing. Even though the mother is not around, they are making sure that they are comforting one another and they are making one another warm. It's important that also Nani as AMA students, you do this example. You hold one another, you do not laugh at one another, because that again happens, and it's not right. If it happens that you go to, okay, you come to me and I give you medication, they don't have to laugh at you that you are taking medication while they are not. No, that is not a good thing, because if they do that, they are going to discourage you from taking your medication, isn't it? So this day, we are just here ukuthi sizokwashisana angithi nge-mental health. Ngiyabonga guys, you can sit. So we are just here ukuthi sizokwashisana. Alright, let's see who is going to win. Ngala, we have team. Ngapha we have team. Alright, let's see ukuthi ubani ozowina kubona. Lalelani-ke, these are the instructions. Yabo ibhelulu yakho loyiphethe. Uyayithi ngahlali phansi lokuyiphusha kanje and you take off your jersey. Then ibhelulu kodingawi ifuka sewuhliwe. You understand? Take off your jersey. Ibhelulu lakho ulokushaya nje liye phezulu, ukhumule ushaye liye phezulu, masuqedile uliphakamise bese uphinda futhi uyaligqoka, then you have a winner. Okay, now they are starting in 3, 2, 1. Yeah, man. Let's see who's going to win. Let us do this again. Because we need to let us try and see if I can acquire ukuthi athi fight back and win, ne? Can we have 3 of you to come and assist her? Regardless of your gender, but at least let's have similar height, guys. About 3 Okay. About 3. Let's see if again you are winning on this one. All right, eh? Bye for another. Oh, okay. I want to see chase. I want to imagine. I want to keep an chase. Huh? All right. See ready? Oh no. Okay. Just like 3. Okay. John Masilas. Mental health there is effect separation anxiety. When you have separation anxiety, you are missing about whom you have spent your time. So you miss them and then you develop the separation anxiety. And then once you have the separation anxiety, you may have symptoms that are going to azobonakala kuwena. And ngesikhathi lama symptoms ebonakala kuwena, they are telling us that this one is anxious because of something. You may drop kumamax wakho. Ngesikhathi drop kumamax, it's because ingondo yakho is anxious about sivala nini ikole ngibuyele ekhaya, vala nini ikole ngibuyele ekhaya, ishaya nini ukugqibela ukuthola ifoni yami ifonela umama. Uyayibona leyo nto? So that one is going to make you ukuthi ube uneasy ungasayenza izinto ezi-right. Uyabona? So uyakwazi ukuthi usizakale kulokho. Bakhona o-psychologist inamba ngiyababona, bakhona o-registered counselors ngiyababona. I am also there as a child and adolescent mental health specialist. Then I can also assist on that one. Okubaluleke kakhulu ukuthi guys, we make sure ukuthi whosoever has a problem, let us report so that that person will get the assistance. Siyayibona leyo nto? Singahlekani. Uthola ukuthi mhlambe when we are going to sleep, what is going to happen is that siyakolala, masiyakolala khona ukuthi before silale uyakhala. We just have to talk about that. We can first talk about it among ourselves and see if we can help one another. Failing which we go to a report that so that we can sizane kahle. And also there is the ADHD. There is the ADD, whereby you don't focus, you are impulsive, ADHD, you are hyperactive, you are doing this and that and very second. All that you come and then we assist you on that one. Okay? So, depression, anxiety. So, we are here to give you more information on each individual that you are interested on. And also there is substance. We are trying by all means to make sure that you don't go to use some substance again, because using the substance is going to ruin your future. You are here because you are trying to build your future, isn't it? But then once you start using the substance, unfortunately, uzolibulala ikusasa lakho. So njengoba silana nale itafula bazobe bekutshela ukuthi how can substance ruin your future? When you smoke them today, zikwazi kanjani ukuruna ifuture yakho? Uyayibona leyo nto? Alright. Bathi bacela ukuwina laba nkosana, bacela ukubaphinda laba basho njalo. Alright. Ngicela abawuthuba ngala bese ngala. Abawuthuba ngala bayena la. 2 from this side go lapha ya. And mani ngala you are going to win for your team. Nani jobanisa ngala you are coming to win for your team, okay? Okay, Nina no itu, you are keeping the balloon in the air. Nina no itu, I am the pants the balloon. They are on. Nage na em shakeni to I fuge, I lale, I fuge. They are on nage. Now social channel with a bese way, aliwe pants. Nina ni awa ni isa Nina no itu. Nani chani pants. Latina pants you have lost. You understand? Latina pants. Let's see who's going to win. Then keep it up. Yeah. You just made participation of person. I'm a judge. I have it. All right. Ni Lucille, Tandazani, Okay, the very same thing. Keep it up, keep it down. And yes, abangala, lana bazodlisa phansi. Abangala bazodno aliphansi lethu. Elizothinta phansi kukala. Those are the losers. Ne? Right. Oh, right, let me see. Right, let me open space. Okay, in 3, 2, 1. Ukuthi sizokwazi ukuthi sinikeze ulwazi noma ngabe yiluphi elifunayo siyezwana so ngiyacela ukuthi nikhululeke niyezwa kungabi bikho la uzosaba khona ukuthi we ngizombuza kanjani nje mina udokotela ngingayena udokotela it's not about that siyezwana buza namhlanje nginganawe ungabuza noma yini ngizokuphendula siyezwana so ngikhululekani bafethu nibuze basezaka abazokhuluma banikeze ezinakindaba mina bengenza nje ngikhombisa ukuthi sizojabula sinikeza ulwazi at the very same time ibelunde elangala ngicela ukuhlala phansi
Thank you very much, Doctor, for that lively and boisterous interaction. I can see that the kids really enjoyed it. Thank you very much. Right, did you enjoy it? Yeah! Can we have a little quiz time? Okay, let me ask you the most obvious thing, right? Doctor said, Ningasabi Kululege, right? Not only that, what else? What illnesses did Doctor touch on today? Mental illnesses. He gave us quite a few. Let's show that we were listening. Mapuru, Saniswa, yes. Lovely. Guys, let's listen to Saniswa. Right, Saniswa, yes. Can you repeat? What? Yes, separation anxiety. And I forgot what separation anxiety means. He explained it, but I forgot. I need you to tell me. Explain it to me, please. Yes, Lugelo Sane, yes. Please, yes.
Doctor said that separation anxiety is the anxiety that you develop after you have been separated with the people that you love and you start missing them.
Is she correct? Yes. And then Doctor also mentioned ADH, or even that too. I don't know what ADH is. ADH. What does it stand for? Is that an abbreviation or acronym? Abbreviation, yes. So what does it stand for? ADH. Yes, Samshambu, tell us loudly. Guys, let's settle down. ADH.
ADHD stands for attention deficit hypertension disorder.
Well done. Thank you. Thank you guys, I must say. You've been very attentive, I can see from your responses. Can we now move on? Or more quizzes? Okay, we're moving on now. Right, okay, let's move on guys, let's move on. Now we're moving on to the introduction of all our speakers who are here today, of all our guests that are here today. And we have Mr. Shumba, who's going to give us a background of each one of our guests that we have here today. So let's give Mr. Shumba a clap. Thank you.
my task is very simple this morning. I have a very special task, but before I introduce these wonderful speakers, I want to say something very profound. We invited them last year. It was our first event. They honored this invite. We invited them again. The partnership continued. If I say we, you must understand. Then you must understand. Today we witness them again in full force, and they are here to support us. And one thing which is very important is that as we are preparing for our exams, they are doing a great job for us as teachers, because already I can see you motivated. Clap hands for yourself. You are motivated, and we really appreciate and honor that. Now we have wonderful guests, wonderful people who are in our midst today, and I'm going to call upon them. And just to mention a bit, maybe I'm going to call out their names so that they can stand up for us to see them. So, the wonderful people in the house who have graced our occasion today, I humbly request you to stand up as soon as I mention your name, so that at least we can give you the perfect respect which you deserve. So we have Mr. N. Kumalo, the one who was just gracing us. Mr. N. Kumalo, can you please stand up? And then we have Miss S. Pakati from Department of Health. Where are you, Miss Pakati? There she is. Yes, she's in the house. Right, we have Mr. A.E.D. again from Department of Health. And then we have Miss S.E.D. from Media. Yes, there we are. Thank you so much. And then we have Miss T.M. Trele. T.M. There we are. She's from Department of Health again, the registered counselor. And then we have Miss S. Gomese. And then we have Miss S. Tole once again from Cloud Therapists. Thank you so much. We love you. And then we have Mr. Sibusiso Matenjwa. Mr. S. Matenjwa. There we are. Okay. And then we have Miss Ngati. Miss Ngati. Yes. And then we have Miss N. Gomete. Right, and then we have Miss Fuzile. And then we also have 3 media houses. So anyone who is representing these media houses, can you please stand up? We have Nada FM. There we are. Okay, for the second time, we are now representing the organization. It's fine. And then Gama TV. FM. There we are. For the first time, 3 media houses covering us. Right. So, now, we have 3 more guests again to honor. You have honored them again, but let us honor them for the second time. To respect also their title and their enthusiasm in this field of mental health issues. With Dr. Mieza, we have the request you to stand up. And then we have Dr. Mube Gasa. And then we have Dr. N. Indajet. Can they stand up? You can clap your hands better than that. Thank you so much. We honor you. My job is done. Thank you so much.
My, aren't we blessed today? We've got doctors here, we've got media houses. No, maybe we should take a picture. Thank you very much, Shumba, for the introduction of all our very important and vital guests that have graced us today. Let us move to our next aspect of the program. We are moving to the next aspect where we will be introduced to our keynote guest speaker, and that introduction will be done by Mr. Zulu. Mr. Zulu is going to do the introduction of our keynote guest speaker today. So let's give him a clap as he comes to the front.
Ladies and gentlemen, here our next speaker, a very special person. She completed her undergraduate degree in medicine at Nelson Mandela School of Medicine in 2005, qualifying as a medical doctor. You were not born as yet. In 2017, she obtained a specialist degree in psychiatry. She has worked in non-KZN at Welezana Hospital. She started a practice in 2018 and has been in private practice ever since. She practices in north of Durban and Umhlanga region. She also has joined RightMed Medical Care Malito. Her experience in working with both young and old patients, treating all psychiatric conditions, and has special interest in child and adolescents. Her experience in working with both young and old patients, treating all psychiatric conditions, and has special interest in child and adolescent psychiatry and educating in mental health awareness. Please, ladies and gentlemen, clap hands for our next guest speaker, Dr. Nokuthula Nubegasa.
Unfortunately, mina angifani nomkhumalo bese ngimcelile ngamhlebela ngathi ngicela phela ukhulumele kodwa wathi oxuba igqumele ngoba you guys saw he can, he's got stage presence, he can speak. But what I like about what Mr. Khumalo said is the fact your anxiety, of which nami, as old as I am, I also have anxiety, but I have social anxiety. The performance anxiety. I'm sure nabanye bias, but we'll still talk more about that. Ngibonge principal Wanaikaya kanye nabo bonke ama-educators and all the stakeholders from different institutions abalenze lolu suku labayimpumelelo. Ngezwa ukuthi even last year beninalo lolu suku. Ngiyabonga, ngiyajabula for that ukuthi in this day and age kukhona abantu abadala abayibonayo i-importance ye-mental health yokuthi nithole ukufundiseka nolwazi about mental health. And I hope ukuthi njengoba this is your second annual mental health awareness event. I hope it never stops, even a legacy that continues from here onwards. So, Mina ngizokusho kube nje short. I'm going to give you guys snippets in terms of the world of mental health for a young person. So nina njengoba nidlala nonke thina si-refer kunina sithi ningama-teenagers or ningama-adolescents. And mina ngizogxila nje kakhulukazi kulokho for today. One thing ekumele niyazi ukuthi whether umncane noma umdala, from umntana as young as 3 years of age to umuntu omdala as old as a person can be, sonke we can be affected by mental illness. Ukuthi kuzoba izinto ezihlukile ukuthi yini affect isibanibani, yini affect isibanibani, kodwa sonke we can be affected. We can face some challenges like mental health, mental illness. It doesn't matter ukuthi ubani, it doesn't matter where you come from, race, gender, social standing, even nangekolo. Sonke by virtue of being human beings, we can be vulnerable and we can face some challenges. And the challenges is our family. So I'm not sure if it is projecting on the screen, the first slide, just an introduction of mental health awareness. It's not there. It's there, okay. So second slide, it's just an outline of izinto engizothanda ukukhuluma ngazo mafuphi nje briefly in terms of yini adolescent, but we adolescent njengoba ngisho ukuthi nina nibizwa ngama-adolescents, by definition uchaza ukuthini lo. And then as abantu abasha, imaphi ama-challenges esiwabona kakhulu nibhekene nawo empilweni. And then mase sikhuluma nge-health, kuneslogan-ke sana World Health Organization esithi-ke there is no health without mental health. So nje if uzobona umuntu wasemtholampilo noma wakuphi ngize ngekhanda or ngize ngobhozo wakho obuhlungu, but umuntu uqala from head to toe, yebo ngize ngobhozo but uzombuza unjani, uphila kanjani and all other things. Ufuna ukwazi mina if umuntu umkhombisa interest kuyena, lokho kuyamphilisa umuntu. And then we're going to talk about some of the common conditions that are faced by abantu abasha. Maningi-ke njengoba ngisho ukuthi ayikho into engama-affect umuntu omusha. From A up to Z of all ama-conditions akhona under mental health, abantu abasha bayakwazi nabo ukuba affected as such. Amanye ama-conditions amnandi ngokuthi ayalapheka, adlule aphele, bese kuba khona futhi namanye ama-conditions esiphila nawo impilo yethu yonke, or abanye esibekhula ama-conditions ashintshe kube ngcono. To the next slide. Umuntu masithi uyi-adolescent, niyayibona ukuthi kade naqala from the age of 10 already sisuke sesibizwa ukuthi usungene kwi-stage. Angithi khona base sengene kwi-adult. I'm sure you've had people abadala special njani. Kasalalela usenjani, sengene kwi-adult. Iyona-ke le adult kukhulunywa ngayo-ke le adolescent ukuthi by definition ukuthi ngene minyaka from 10 to 19, lowo muntu uzomclassify ngokuthi useyi-adolescent. And isikhathi esinzima-ke bafowethu kunina kakhulukazi, ngoba ilesi sikhathi whereby manje seniyaphuma ekubeni umntana kamama, umntana kababa, umntana kagogo, umntana kabani, and you are transitioning into adulthood. But before ufike kwi-adulthood, kunezinto ezenzakalayo. Uvuke one day ntombazane kade nifana primary nifana ntombazane niyafana and all of a sudden ntombazane you're having physical changes. Sakubona izinto ezenzayo it's like your body is changing. Your body is changing. Umngani wakho ngapha yena uyabuka like how okay sishintsha ngendlela emotionally uthola unama emotions akho ayashintsha. It's like you feel differently, you feel strong and understand. Ngiphikise back ngiphikise if you know ngaliqiniso ngiyathanda ukuphikiswa and understand because there's just a lot of things that are happening emotionally iyashintsha, indlela enicabanga ngayo iyashintsha, ne-behavior iyashintsha and nendlela ena-associate ngayo nomndeni nabangani and the communities ziyashintsha. And ngokwethu thina sibiza ngokuthi le period it's identity versus confusion. Ngizama ukuyithola, ngizama ukuthola ukuthi ngubani mina besides what I know ngitshelwe ekhaya ukuthi okay wena uhlakaniphile umntwana ingane. Yes, I know all of these things, that's how I was defined, but ngitshelwa abantu basekhaya or abangani. Here now I'm trying to find myself. Who am I? What am I about? Yini engijabulisayo, yini engangijabulisi. And I want to also get independence, ngifuna ukuyimela. And that's always, I think, the trickiest thing between ama-adolescents and abazali, thina singabazali, singabantu abadala. Hi, sweetie. Ngingqole, ngibona umuntu wami lapha. So, lokho okusenza mase ngithi ngingxolele guys namhlanje amnyama ngathi yabo ukuthi ngigqoke no green guys ngimeshile backers nokuthi green kodwa nje ngabona ukuthi umbala o green umbala wempilo ilife so yama ngithi ngikhuluma ngathi hayi ngapho badala ngathi. So independence and intimacy is also talking about my emotions owafilayo and the people that you start drawing closer to. Isikhathi se-adolescent is where you put your friends ukala, your peers ibona abasondelele nawe kakhulu versus abantu abadala uthisha, abantu abadala umuntu a parent isihlobo so abantu abadala. So nalapho where we learn ama-morals when we talk about integrity, what is morally wrong, what is morally right. And ngiyafila into makhuluma ngama-injustices you feel it. We're living in a world where it's not safe for you guys, and in a world whereby ingane yentombazane kakhulukazi isedupheni and kusakhona izinto ezicindezelayo injustices. So this is a period where you guys feel and you want to speak, and isikhathi sokuhlakanipha even more, especially kubafana e-primary badala bayinaki into eyiningi, amantombazane asheshe ukubaturisha in terms of emotions nangakanipha but bese kuthi-ke amajita aseyafika-ke kulesi stage and then they come and they surpass most of the time bandlule ama-counterparts abo baqale nabo ukuthi bazithole. Next slide. Ukho konke-ke lokho okwenzakalayo sishintsha, sikhula, sifila, sigowa. Ngithi lena niyagowa guys, siyagowa. Siyagowa all the time. Ukhalakathele sigowe siphinde sibuye. And hence the challenges esibhekene nawo kakhulu, because this is a period of turmoil with all these changes, with all these emotions, with all this information. Iyasihlupha. Ukushintsha kwami ngendlela engibona ngayo is not just about emotions but especially body image. Iyangihlupha because nina niphila in a world of social media. Social media tells us who to be. This tells us how to be who we should be, when to be that, when not to be that. And kuniphila esikhathini whereby mina umhlaba is just at the tip of your fingertips. Yeah, at your tip of your fingertips, exactly. So, umuntu wase-America, umuntu wase-Saudi Arabia or whomever, whether they are catfishing or not, nikhuluma nabo. Ninabangani, angazi namafollowers abangani. On Instagram, on Twitter, on X, or WhatsApp. Low on our followers are 1,100. Do you personally know all those people? Do you know if they are actually real? They are who they say they are. We don't. But umhlaba ukanjalo futhi umhlaba wenu mncane as much as ukhulu futhi uncane because you have access to everything, which also opens you up to access of other things. Hence where the society comes in with the challenges. There's societal norms. Social media, Instagram. We all want to live a self-life. We all want to be on a yacht in Dubai. You know? And what I think so mina mangibuka ngizobuka into yena ukuthi it is what it is, but so it isn't what it is. It's a job for them. They have to sell a lifestyle, they have to sell us something, but no one tells us that. But then for you guys, you have to live through that. You have to live through abazali sithi uhlakaniphile onjanjani, so sibeka ama expectations amaningi phezu kwenu. We want you to be in a certain way. We even go to a point of choosing our careers. Of which siyasilimaza ngoba lapho mina ngizoba umzali ngikhulume mhlawumbe ngifuna sithi living vicariously through you guys. Mhlawumbe ngangifuna ukuba astronaut and I wasn't. So I would want you to be an astronaut. I would want you to be an astrophysicist or whatever. So we put a lot of pressure on you. Whilst already need pressure. By virtue of you guys being in this school, you guys must understand what is spectacular. Yes, understand that it's spectacular. And you must just catch yourself like Muhammad said, and by virtue of being here, divorce me. Yes, that's going to be great. So over by divorce, spectacular also comes at a cost. Ngoba fanele maintain and local singakangeni as abantu abadala sifakele pressure of how to be, where to be. Nani already is fakele pressure because I always have to give my results. I always have to. And then no one comes and says, yebo kufanele kube njalo. However, uma kungenzeki into ebalulekile uwena. We may not get it to level 7 manje because there are certain issues that we're dealing with, there are certain challenges. Let's deal with you. Let's take care of you first because no awenze lutho if wena ungekho. Wena vele ufanele usebenze ku Therefore we have to ensure ukuthi uright ukuze ukwazi ukuhamba osebenzela lo esifunayo. To the next slide. Now I've said a lot in terms of yini healthy men. But again, okay, sikuba nge-health, ukhuluma ngomuntu, baqala bafocus only on just the physical being. And I stay so free from illness, free from injuries, free for anything that can burden me. But in the definition, makunya or healthy, are you bad mental health? Mentally unhealthy because of so now, mina get mentally, emotionally, not cognitively, ngiphilile ngibalance ngiyakwazi ukubhekana nezimo ebhekene nabantu abancane kulesi sikhathi ngiyakwazi yini ukuthi ngibone ama-abilities ami or do I feel under pressure and ngilose such who I am and what I'm capable of and ngiyakwazi ukufunda izinto ezintsha, learn new things and work well under any kinds of pressures and ngikwazi ukuthi ngizibone. To the next slide. As I say again, here we are. I will take ukuthi nina esikoleni, you are the community, family. So how do I then see if I or umngani wami or a classmate has any issues or kukhona into engayiboni kahle? These are just a few telltale signs ukuthi umuntu ungabona kanjani. How igama lami unothula. How uyabona unothula sengesikhathi nje sokuthi imood yami ayisayiboni kahle. Most of the time, yes, umuntu uyabaset, you can be angry, irritable, and express all of my emotions. But khona la isikhathi ubona ukuthi how most of the time senginama mood swings. I'm sad or I'm irritable and I'm snappish. I ayisenzeki mhlambe even once in a month or once in but sekuba more persistent and more frequent, then you start looking at lowo muntu or yourself. Oh, uyabona ukuthi ama-marks ami ayadropa. Ngiyazazi ukuthi ngihlalaphi, ngiyazazi u-average wami ubani, but now I'm not coping. Angisakwazi ukukhopha ukucabanga, ukuconcentrate, ukukhumbula, and nalokho kuyangifrustrate ukuthi angisenzi kahle esikoleni. Ama-marks ami ayadropa because ngakudropha ama-marks, othisha bayabuza, abazali bayabuza. Everyone asks makudropha ama-marks. Masathiwa, hi, namhlanje we-weekend, we go and have ice cream or we go play games. I'm not that interested, I'm not that keen. Angisathandi ukwenza izinto that ebengizazi ukuthi ngiyathanda or lo muntu ukwazi ukuthi uyayithanda. Ngenza ama-excuses or ngithi, oh, Friday sohamba, yeah, masakusondela Wednesday, ini sengiyaqala, I'm pulling back, I'm making excuses, I'm thinking, oh no, I have to find a way to get out of this because I just can't. Not more bad because like you feel like ngiphathele, I can't. Yigama elisebenzisa kakhulu ukuthi nje ngikhathele. Umuntu methi ngikhathele ngiyamlalela mina ngoba ukukhathala may not just be okwa-physical ukuthi ngikhathele, but it could mean a lot. Ukukhathala, igama esinje ukukhathala could mean emotionally, could mean spiritually, could mean anything. So umuntu uma ekhathala, ukuthi usekhathala kaningi, you need to take a closer look at that person or a closer look at yourself. Kwenzakalani kahle kahle. Ama-behavior patterns abayashintsha. In my short-temperedness, sengiba snappish, sengiyaba nama-outbursts. Hawubesidala nje sometimes siyadlala ngokudunana, base athakhona ukudlala manje. I don't take things lightly, I take them very seriously, and indlela engiyenza ngayo, engiyetha ngayo, iyakhombisa, ayisafani na before. Ukulala kwami akusalali kahle, sleeping patterns are changing. I'm having insomnia umuntu eba nenkinga yokulala, lack of ukulala, not because I was dead, but uthola ngifike okuqale kodwa uphaphabe phakathi nobusuku and you cannot go back to sleep. Abanye nje alale kodwa kuke ngabona from 3 kuyoze kuseke akalali. Indlela engidla ngayo isiyashintsha, i-appetite ayisekho or sengidla kakhulu. Those are all telltale signs which you can see without doing ukuthi ngize ngithi une-condition, even if kukhona into engaphezu ekhulumeza emoyeni. Those are the things you look for. Is-stress, and ngisho ukuthi well, I'm stressed. Khona into as adults esensithi uthi une-stress, u-stress wayini lona? Akasebenzi nje, uyakwazi ukuvuka emsebenzini, uyakwazi ukubhekana empini. So there is this misconception esinayo as adults nabazali ukuthi nina, you guys don't have stress. Because sibone ngathi impilo zenu zi-right. So why should I be stressed? But nina-stresseka nani, whether you verbalize it or ngibone ngama-emotions ogodukayo, useyivalele ekamereni, akasafuni ukubonakala, you're more withdrawn. Umuntu, oh, simbona mayezondla phela, oh, hayi, ado, yes, kubeke kanjani. And then because of all these things, some of us then start experimenting with substances. Whenever I see umuntu omusha esebenzisa ama-substances, my question is, what is the matter? Ngiyayibona i-substance kodwa ngibuza ukuthi yini emenze waya kwi-substance in the first place? Because there's always a backstory as to why a person is using substances. As much as uyabheka, uyaphuza, or you are ingesting whatever, but yini ekulindele to that because there was a cause. So we go and look for those things. Ukungabe right emotionally, ukungabe right mentally, then it impacts on impilo yenu, as you can see. Ama-academics, performance iyehla, attention, concentration is affected. Your relation with your peers, your relation with even yourself, your relation with abantu bakini in uya-withdraw, and you feel isolated, you feel lonely, you feel even excluded. And abanye abantu, when they're going through anything, begowisha, abanye bayasaba ukukhuluma ngobani, sisaba i-judgment, sisaba i-stigma. Ukhona lento yokuthi umuntu ngisho umdala, abantu abadala bababona umuntu, yo, if ngiza ngizobona a psychiatrist kusho ukuthi ngi-weak. I'm like, weak? No, you're not weak. Do you guys know a Bugatti? Do you know a Lamborghini? Do you know a Pagani? Do those cars go for service? Why? Why do all cars need to get service? Yes, why do cars need to go for service? All cars need to be serviced. I can hear you on the spot, it's just sharing. Imoto zabo service ngoba fanele njalo sinakekele si-check ukuthi sahamba kahle ukuze iBugatti nePagani zibe imoto omesa ababoshelwa zona babehamba ngazo nabahamba ngazo fanele zi-maintain. So if iBugatti or Pagani or Lamborghini be ama-fastest cars, they go for maintenance, why can't we as people go for maintenance? We go for maintenance. When we're not okay, we should get maintenance. When we're going through things, we should go get maintenance. We are sure ukuthi Lamborghini week for service. No. Is even naked, young imoto naked, Thomas uhambe kangaka, ihambisa. Masibu, ihambisa. Nathi ke as people, we need to be serviced. We need to go wherever it is, la ongaya khona to get usizo. And that's why I am a psychologist. That's why I am a social workers. That's why I am a counselors, psychiatrists, to your principal, or in terms of guidance, emotional well-being, whomever, that's where you go. You are not weak. I even go down to be weak. Because ukhona into esishoda ekhaya kufanele sibuye sizoyilungisa sinike sinike amandla sinike hope and sinike nendlela ezintsha zokuphila iphindele emuva iyokwenza umsebenzi emele yenzeke. Because if singasebenziswa guys, if singatholi ukuphila physically, emotionally, mentally and spiritually, sizogcina sithola ey'nkingeni njengalezi ezolandela. Sizogcina sithola sizame zethu indlela ezingekho healthy zokucope. Sizogcina sithola uma khona umuntu ongasondelana nawe emotionally, sengiyisondele eduze komuntu kanti omunye they just have amanye ama-intentions ngami. Ngizogcina sengiyithola ngenza izinto eziyinyusa i-adrenaline yami because I want to live, I want to feel something, I want to feel different. Ngizogcina ngithola ngingena ama-fights and so on. Stress ngiyasazi njengoba bese ngishilo. And the stress is yini? Uma stress, remember, stress is normal. Uma ungekho stress ngento kusho ukuthi awukho interested in it. So ngokwakhe kwasi stress is normal. Ngoba i-stress senza umuntu aphaphame avuke in whatever situation, afune ukwenza kangcono, afune ukwenza kahle to prevent whatever may come. If we have a test, you study because you don't want to fail. If kune sports tournament or anything, ama-athletes, they train. Ngobani khona bazokwenza ukuthi kwenza kahle kusasa, amabhokobhoko azokadlala, I'm hoping right now they are training. Khona mababhekene ne-England kusasa bazokwenza ama-flames, I'm hoping. So we get stressed because imoto indlela endalwe ngayo ukuthi iphushe ngifuna ukwenza kangcono. But i-stress siza-ke umuntu bese kuthiwa-ke u-anxious. Everyone gets anxious. Everyone experiences anxiety. And that anxiety is when you're feeling worried, you're feeling stressed. And it is still, we get anxious because we need to protect ourselves. You need to do better. You need to be the best, or you need to be whatever it is. And then we get anxious. Some of the symptoms they're anxious, from ekhanda kuze ngaphansi, you can feel different things. Okwenzeka kunokuthula angeke kwenzeke kusipho angeke kwenzeke kusimama. So okwami mangi-anxious ngaqale njalo frequent headaches. I'm getting these frequent headaches ngiyaphuza amaPanadol, nothing is happening. I am having these moments whereby I'm concentrating eklasini nakhona kuyenzeka. And I'm having these moments whereby I'm feeling dizzy, ngiyasukuma or I'm feeling dizzy. I have tingling feelings in my arms, in my hands, in my feet. My heart beats like it's going to come out of my chest. Ngiyizwa iba lump on my throat and I can't breathe. Even pins and needles. Omunye umuntu uyafainta. Literally, you can faint and you feel like you're going to lose control. Those are all the things that umuntu can experience when they're having just normal anxiety. But for any condition, masethiwa-ke manje-ke lokhu usune-condition edinga ukuthi ifakelwe amehlo ibukisiswe kahle. Mase sithi umuntu usene-condition eyi-disorder. Into ezoba i-disorder empilweni yami nasempilweni yami, anything ezoshifta ubuwena, ezokukhipha from your normal life, ezokushintsha indlela oyiyo esikoleni, indlela oyiyo personal, indlela oyiyo nabangani bakho. If it starts causing impairment in how you are, uyazi lokho ukuthi-ke isi-disorder ayikho right. So, and that's how even lama disorders esikhuluma ngayo ngama-challenges abonakala kanjani. I highlighted just a few briefly because maningi ngisho from A to Z. Most adolescents nina kwiteje nikuzona ni-affectwa kakhulu i-anxiety. Ni-affectwa kakhulu under ama conditions ebizwa ngokuthi i-depression. Ni-affectwa kakhulu abanye, but even though abantwana ababa no ADHD, no ADD, siwabiza ngokuthi ama-neurodevelopmental. So leyo condition uthi vele umntana from ebumncaneni bakhe usa 6 months in kukhona izinto ezishoyo ukuthi yena is not make sure, but sobona as we go along. Kuba njalo, and then vele masusesesikoleni ukuthi yindaba ADHD. Niba affected kakhulu high risk of suicidality. Whether it's suicide attempts, whether it's completed suicide, those are the things that affect you guys. Niba affected substances. It decreases stress, and then I start smoking, I start doing exercise, ngibheme manje sengithola ngikuphike sengibheme izolo sengiyasuka lapho ngithola kwabanye sengiyancika sengiyasuka lapho sengiintashi ngiyabona siyaqhubeka yonke ngibezeni kuze kufike la umuntu senenkinga khona. So these are all among key issues which you guys are facing kulesi sikhathi nekusona. Different types of anxiety, but njengoba ngibona ukuthi the more manipula nangeminyaka and the number of how many young people are affected by their condition iyanyuka. The anxiety ebuncaneni from the ages of 10 siyababona even more, but the anxiety uzoyithola ukuthi lena as nikhula izona affected differently. Girls are affected more than boys always, but it's not because we are affected. Abantu besilisa ngiyacela esinikhula ningalahlekelwa lento of wanting to take care of yourself, because abantu besilisa they tend to try indoda yenza njani ayikhali ikhala ngaphakathi ifela ngaphakathi iyasibulala-ke leyo nto as abantu. Umuntu uyakhala, the day you were born wawukhala, waphuma wakhala, ukukhala kwakho kwakuyindlela kwakhombisa isayini yokuthi uyaphila, and you need to cry khona umoya uzongena emaphashini akho. So ukukhala is not a sign of weakness for anyone. Ukukhala is an expression of an emotion of whatever situation obhekene nayo ngaleso sikhathi empilweni yakho. So kumele sikhale, but because of that most abantu besilisa do not go for help. Ngobani? Izobonakala engathi usiya emasulator angisasiyona indoda warawara in. So you guys don't go for help. So I think there's more of guys than girls ebagowisha izinto, but bayavumela ngapha bathi yes. And then under lawo ma-anxiety conditions esinawo, ama-symptoms umuntu kuthiwa mayene-anxiety apresenta nje the same as what I've said. Sekuzohluka ukuthi-ke nginayiphi type, maningi ama-type ama-anxiety disorders, from as bakumanashini from ebuncaneni separation anxiety. Uma kukhona oyikhumbulayo first day eya e-crash noma first day eqala e-primary, all coming to the school ephuma e-primary as a high school to a new environment, how you felt. Zonke we reacted again. You're coming to a new environment, you're already thinking, oh my gosh, so what if they don't like me? What if they're bullies? What if what if? Already all of these things are coming through. But I can discuss it now. And then the most common of my anxiety for Abandabasha is that of being generalized anxiety, where your mind is constantly overthinking. Because your mind is constantly thinking. But I most of the time it's worries and fears. And it feels like I cannot stop my mind because it's always going. I need to stop my mind, but I can't. And I feel like I'm not in control. I know I shouldn't be thinking this way, but I'm thinking this way. So what am I supposed to do? There's a conscience. And I was because my overthink. But you can't. Social anxiety, as I said, just having a thought, what if I trip, what if I fall, what if bang, what if those are serious things that happen to each person. It's not because it's because they are struggling with these anxieties, but from talking, and then if then seeking professional help. And because you guys are lucky for all these people who have dedicated their time to help life. Second condition, depression. Depression. I'm so depressed. Oh my gosh, how could he? Because I'm feeling sad. I am feeling sad. I'm feeling lonely. I'm feeling hurt. I'm feeling all those things. Those are feelings of sadness, but I'm not really depressed. Because I'm depressed. This is the thing you feel like is not good. This is the thing you feel like say affect how I live my day to day. Say affect who I am. And depression is the second most common condition. And because of depression, I guess what is said. I don't like people. I don't like talking to people. People just make me angry. I don't want to talk. Okay, I think as I said, and when you're going through depression, your thoughts are constantly negative. You're thinking negatively about yourself. You're thinking negatively about your abilities. You're thinking negatively about success. Negatively about the first thought of very obvious. And you feel like you're a burden to now. If it can be severe to the point of leading to of hurting yourself or even trying to take your life, which is a very, very serious problem. Suicide. From suicide is between the ages of 15 to about 29. In South Africa, it's 15 to 24. Second most common cause of ukufa unina abantu abasha. Abantu besifazane, they mainly attend. We attend suicide, whether it's by overdose or any form of other methods. It's a cry for help. Something is going on, something is happening. I am unable to cope. And therefore, when you use this, as well as that's a thought of who's going through or having a signs of suicide, and who also has a signs of being depressed. And from there, it leads to gay magic, and people actually attempting, females as the attempting, that's a cry for help. umuntu athethayo, umuntu ozihurtayo, we need to take a closer look. But even for you guys, I've had abanye abantwana whereby it was umngani owatshela abazali ukuthi I'm worried about so and so because he or she is doing this and this and this. So uma ninaleyo sisterhood, brotherhood, ningalahlekeli, look out for each other because not everyone is able to speak. As much as Manifestation they will attempt the most, abantu besilisa will actually succeed in killing themselves. Abantu besilisa, they do horrendous things because they use most lethal methods. Bayazibula, bayazihenga, bayaziwaza. We've seen all these cases. Or they will throw themselves in front of cars. So all of these things are worrying. There are things if a legacy spec won't want to be a risk. A man is always our fan. Going through abuse, going through any form of trauma, physical trauma, emotional trauma, sexual abuse, bullying, not just physical, but even cyberbullying for you guys. Those are risk factors. Any changes in your life, even they can be because they're feeling so overwhelmed and or now changing in environment. So from we are adapt or that can break that. Changes the kaya, all those things then present instability. So they can be risk factors, or if you're going through any mental health condition, any challenges, you can be at risk. As I've said, conditions, it's because they are more pertinent to Tina, and which could seem to cause a bit more of a negative impact in a millennium mood. Self-harming. You guys harm yourselves, not because nifuni attention. Ukuzihama kusuke kukhuluma okukhulu. Umuntu oziphathayo, umuntu ozishisayo, umuntu ozishayayo, umuntu ozibhengayo in things. Yebo, uma ungaboni ukubukela ngaphandle ukuthi yini inkinga yakho ifuna attention, but it's not that. Lo muntu kukhona into adila nayo but akakwazi ukuyivevelaza, akakwazi ukubeka ngamagama ukuthi kwenzakalani. Let's take a closer look. Umuntu ozikhathayo, ohlala egqoka amajezi, ngiyacela nosho abahlale sekuyi-spring and we're going to summer. Abantwana abahlala begqoka amajezi namangudisi umuntu ey'fikile, sometimes they're hiding a lot of things abangafuni ukuthi zibonakale. Because the emotional pain is so intense and they do not have any control over it. So then, when they harm themselves physically, it helps to distract them from the emotional pain, but to focus on the physical pain, and you can see blood. And the time I come and I feel relief. And that's because just of the biology. So when you get hurt, your brain sends signals to that part of your brain. It's our own brain has its own analgesics or painkillers. Calmness. Biologically. But if they harm themselves, may not pass or hurt, I may use substances. As I've said, and then graduate to cannabis, to e-codeine, which has been, I think, for the past almost 10 years now, into for young people. But I will blame Little Wayne for now, yes, because they seem to have been, because my idols are singers, Nabo empty, they idolize, right, and then there's a song which I detriment to Zabantu Abash. And then from there, because you're getting happy pain, I need more, I need to do more, I need something else. I sense it, cool. Saying cocaine, saying heroin, saying even foul rock and all those things. These are serious conditions. And who is struggling with any substance, please speak to someone so that person can have help. Eating disorders. this one, as much as it affects abantu besifazane more than abesilisa, but wonke umuntu uyakwazi ukuthi abe affected due to external factors also. What society, what the media, what my family says. Mhlambe mina ekhaya mina ngento umshado wami yabo bonke abanye bona bazalwa besimini, so it's always like awuwenzi weight or awuyekhula inini, forgetting ukuthi i-weight can be because of biological causes, genetically. If ekhaya mhlambe kukhona leyo genetic sizoba bakhulu, whether you eat or not, you gain weight. Whether you have certain conditions, conditions, no ungayistaba if you gain weight because umzimba wakho unezinto ezenzakalayo ngaphakathi that affect that. So it's not a matter of umuntu athiwa uthanda ukudla, ulazy, unjani. We need to find out what's causing it, because those things lead to these conditions whereby people, because they're not happy with their images, they're starving themselves, or which hurts them and could have serious implications in terms of e-health. We lose people. Number one cause, besides we suicide rate. Number two, number one, especially because of our complications, anorexia, your organs they fail. From the brain to the kidney to the lung to the liver, everything shuts down. My message is, as much as there are all these conditions as porn, prevention is always better than cure. We must prevent. Trying to live a healthy, balanced lifestyle. Balance umuntu omusha, irole yakho as umuntu omusha, uyafunda, you need to funda academia, you need to also have a social life. Balance. You need to have extramurals. You need to have extramurals. So you need to live a balanced life. It can't just be hard work, and no play. Because then, demotivated. So we have to try to find a balance in between. I need to too much excessively. And this is what we said as promote mental health as about young and old. Ulala is not just about you resting, but it's the time when ulala, your body gets to restore itself. You should ulala, so you can retrieve them. Guys need to study hard, but you also need to have a routine as to how you study, even in timetable. They usually recommend after every 20 minutes you take a 10-minute break. Because for a whole hour. So you need to take care of yourself, especially during this class. Have those breaks. Hence, if you I hope I'm not too sure in terms of how to address this boarding ma'am and boarding master. Kuneskhathi sokulala wonke umuntu le ndaba zokuswatha ukuthi kuze kube over ngesekulala 2 hours. Trust me, that's how blackouts happen. Umuntu afike lapha unyamalele because ingqondo yakho ayisolanga isikhathi sokuthi yonke lento obukade uyifunda uyithathe uyibeke bese uyayikhipha masudini. So sleep is important. If you now exercise. When we exercise are issues to people guys. Exercise can be anything. Walking is exercise. 10 minutes of your day, anything. Yes. You must exercise. When you feel good hormones, as what you guys, the obvious zonke lezi zinto esinazo emzimbeni, but we need to nabo neurotransmitter laba umuntu engibethela wona ama-medication abo antidepressants and stuff, we have that in our own body. So exercise, meditation in any way. Meditation is la okwazi ukuthola khona isikhathi, be it ekuseni, be it ebusuku, where you spend by yourself, you focus on yourself, but to focus on izinto ezi-positive, to kind of get us into totally grounding. You can start your day with your meditation, even ukulela meditation. Because uthola i-grounding, uthola isikhathi uqala usuku lakho through that, even uqeda kwabanye they can do it, ntambama you can do that, you can meditate. Healthy eating. Ngiyazi alibona ama-famous, ama-veg, nani, but does those things ziyaphilisa. Yes, you can have your ice creams and whatever, delicacies and chocolates, nabathanda mina, I'm a meat person. So yeah. But lokhu that healthy, kuyasiza, kufrida umqondo wethu ukuthi. And for those who are creative, uma ngakwazi ukukhuluma ngama-emotions akho, write about it. Keep a journal. Akube nendawo la kwazi wena ufila safe ukuthi ukhiphe uthulule whatever ezinenga phakathi kuwena. La uzokwazi ukuthi masithe wayikhuluma uyabona ukuthi oh, the world didn't hate and I'm still alive, so I'm not the world's worst person. And ukwazi ukuthi i-exhale. If lokho actually singakwazi ukuzenzela, that's when into esho ukuthi usizo luhlale lukhona. Usizo luhlale lukhona. I'm sure nala esikoleni bakhona othisha that was gravitate towards that person. I'm sure kukhona ama-counselors as we have today, as Khumalo has said, this is the day. Ungasabili usungashiyi because there's no judgment. Wonke umuntu uyagomisha about something. Okwami ngabancane, okwakho ngabakhulu, but for the fact ukuthi akukuphethe kahle, we need to address it. Talk to someone, talk to mntomdala, talk to your friend, talk to a professional. And if konke lokho sesenzamile, then sekuyabala ukuthi professional help is there, professional healthcare users are there. The psychologists are there, the counselors are there, the social workers are there, abefundisi are there, othisha bethu are there, the psychiatrists are there. Thina sifika ke lapha ekugcineni ke sesithiwa ke okay sekwenzekile ini, these are the conditions, this is how umuntu is presenting. I sit with you, we go through everything. Ngoba wena wonke I need to know you. Apha establish ke impela ukuthi si manage kanjani lento obhekana nayo, management of that condition, but management of you and nabantu abakusupportayo. Kwi-team yethu manje usupportwa wena, abazali, and the closest people kuwena, bonke labo they form part of our multidisciplinary team. And even umfundisi wakho if ukuthi ukhona or whomever is your spiritual counselor. So, as much as there's a lot, guys, one thing I would like for you to remember, number one, ayikho inkinga encane, ayikho inkinga engadingi attention. Yebo, mhlawumbe kwami angishonelwa ngabazali, but by effect ukuthi ubaba wami is not in my life, or abazali ba-separate, ba-divorce, or something is happening. Lokho makungangiphethe kahle emoyeni, we need to address it. Akudingeki ukuthi kuze kuthiwa kuyi-condition ifanele uyobona somebody professional, but you need to have healing it is. And then always remember, the most important person in your life is you. Yes. Akekho futhi odlula wena. You are the most important person in your life. Uqala wena. The reason we say that is because when if ungazinakekeli, then you can't even love labantu osuyabathanda, your loved ones, your parents, your relatives, your friends. So into yonke mayiqale ngawe. And hence I say, uma umuntu angathi waze wayitshela uthi yebo vele fanele ngitshele, if ngitshela ngizotshela ubani? Who should know you better than yourself? It's always you. So, ginifisela konke okuhle guys, as you're going to embark on ama exams enu. Remember, study, rest, have time for leisure, find a balanced routine, work with it, with abothisha bethu, with guidance and all the best. Ngiyabonga.
Thank you very much, Dr. Mube, for that information. We really appreciate it, and I believe that our kids have really benefited from the very mouthful information that you gave us. Right, okay guys, let's get our blood pumping. Entertainment. May we please have Mrs. Kolile from Cloud Therapy to please get us lively and pumping. Right, Mrs. Kolile, may we please give her a clap.
Where's the energy?
I am a mental health counselor, a cloud therapist. Bakuna sa pagkabesa ko, cloud therapist maybe. Okay. So I'm not exactly going to entertain you guys, but I want you guys to see the power of the mind. And I'm sure it's a for a while, and most likely the concentration is going out the window. I can see someone is fidgety, someone is stopping every now and again. So which basically means that you guys are now anxious. So I'm not going to be entertaining, but I'm going to show you guys how to be grounded. Our speaker who was up here a moment ago said something about being grounded. She said something about meditation and whatnot. So I want to actually show you guys what that is like, so that you can at least have an idea. You'll be no man, that very probably just do jobs and whatnot, boring. But the exercise is supposed to assist you guys with the power of your mind. So, if you could just stand up a bit for me, I'm sure some Alex can see a bum turns, yeah, a little bit. It's relieving, So I want you guys to shake your arms, let your energy flow, shake your feet if you can. Thank you, get your blood moving. Alright, so set how? What did you do time? You want to dance? Of course you dance. Of course you dance. You don't put this up. Okay, do we have any music? Wait.
orientation and TikTok. Unfortunately. So let's just give them 2 minutes, Rihanna, and then they'll get it with me.
Okay, in the meantime, so that we have our minds open for the time when I can actually say what I came here to say. I want to first say something about school, or rather my first observation. You guys are absolutely beautiful. I'm seeing black excellence at its best, like higher. And I hope that you guys can be able to sponge in your Benedict surely by black excellence. This is the cream of the crop of black excellence, to be quite honest. So the reason why we should local is because how Ubuntu is structured mentally. We have our self-identity, we have our purpose, and what we think we were all born to be, a identity. So sometimes, unfortunately, I'm not able to know immediately who's blue back, because no one is actually born with the name of knowing what they're going to be. Sometimes I know what I want, but I don't know how to go about it again. So hence, abanye will have identity crisis, or who is going to be depressed because, well, I don't know who I am, I don't know what I came here to do in clubbing, and nobody is also going to tell me that I need. So here's then where mental health, some of the mental health functional disorders would then come in, which some of it would be who is having self-esteem issues, they don't have confidence, or there's body dysmorphia, where every single time I'm looking at myself in the mirror, and can't, So we're going to get into the groove of that as soon as we get over this groove, whatever it is. So what that says, he says, okay. You all are just going to close your eyes for me. Trust. The only way that this exercise is going to work is if all our eyes are closed. So then niggas will go like because that's how we do it by mental health. Everything is meant to be confidential. So basically meaning, so you are struggling, so you are depressed, or so you are angry, or so things are not well at home, or not coping in school. Everything that is done or as you come forward, everything is confidential, meaning that the next person is not going to know about Inabaya. Because sometimes we fail to trust our professionals because we think if the woman is then most likely what is bothering me, most likely my teachers are going to know or my classmates are going to know. So I need you all to trust me by closing your eyes, even our guests. Everyone can just close their eyes. I want to show you guys something by me doing this. You can close your eyes. Are we sure our eyes are closed? Thank you. Okay, so I want you guys to focus on the sound of my voice. Yeah? It might not be the greatest, but I'd like to think that it's soothing. So as you guys are sitting there, I'm sure that the room is absolutely silent. Except for a few individuals coughing here and there, but such is life. So as your eyes are closed, try to put both the palms of your hand on your knees for me. Without opening your eyes. I'm sure you can move your hands without opening your eyes. So both palms on your thighs. So as your palms are on your thighs and your eyes are still closed, I want you to draw in a deep breath for me and try to relax as much as you can. As I say in, you will draw your breath in through your nose and you will let it out through your mouth. So take a deep breath in for me, hold, and let it out. It might be a little awkward if this is your first time, but I do assure you, since your eyes are closed, no one can see you. Take another deep breath in for me, hold it, and out. As you're breathing, I want you to try to listen to the sound of as it enters through your nostrils. I can see you in the jersey. Close your eyes. Thank you. Take another deep breath in for me, hold, and out. I want you to focus on the feelings of the palms of your hand as they're touching whatever it is that you're wearing. Are you feeling a warm? Is it a rough surface? Is it a soft surface? Don't tell me, just feel it. Take a deep breath in, hold, and out. I want you to focus on the silence that is overwhelming the room. It's hardly anything. Silence always represents peace. It always represents stillness. Take a deep breath in for me. Hold and out. I want you to feel your shoulders relax as you're taking in your breath in. Hold and out. I want you to focus on olfactory senses, so that would be what can you possibly smell right now. Try to think about it. You're going to tell me it could be your perfume, it could be stay softly in your clothing item. As you're thinking about what you can smell, take a deep breath in, hold, and out. Take another long deep breath in, hold, and out. As you do this exercise, I'm sure your body is much more relaxed. You was everything that I'm going to say, and I would like for you to answer as honestly as you possibly can. So how this exercise is going to go, I'll ask you a series of questions. If the answer, or what you think the answer is, applies to you, I need you to pull up your hand and keep it there up until I say I'm finished with the questions.
Take a breath in for me, hold, and out. I need you to put your hand up if you've lost a parent. Remember, no one here can see. Everyone has their hands, the eyes, closed. You need to put your hand up if you've lost a parent, if you've lost a relative, a grandma, grandfather, lost a cousin, a friend. I need you to put your hand up if you have an unpleasant relationship with your parents, have a you don't understand. If your hand is already up, do not put it down. I need you to put your hand up if you struggle to a point where you feel like I can't do this anymore, or I don't know how to do this when it comes to school, for our guests, it could be your work. I need you to put your hand up if you're struggling at home, it with a spouse, a friend. Relationships are not what you need them to be. I need you to put your hand up if sometimes you just feel like people don't understand me. I feel alone. I feel like I don't want to do this life anymore. I need you to put your hand up if you're always feeling sad, overwhelmed, angry. Don't put your hand up don't put your hand down if it's already up. I'm sorry. If you reply yes to any of the questions I've already asked, I need you to keep your hand up. I need you to put your hand up if you feel like maybe I'm just not good enough. Maybe I don't look pretty enough. Maybe I'm not clever enough. Maybe I'm not doing enough in school. Maybe, my teachers just don't notice me as the next person. Maybe I just don't know how to do the subjects that I'm doing. Maybe I need a change. Maybe I need to change in my work or anything of the sorts. Thank you so much. Don't put your hands down. I need you all to open your eyes now. Don't put your hands down. All of you. Eyes open. The questions are done. Thank you. Can you guys see how many of you in the room who have your hands up? Even part of the panel themselves have their hands up. The reason for this exercise, you can put your hands down guys before you get cramps. The reason for this exercise is to show you guys just how many people need help. If you have your hand up, you need help. If you have your hand up, you need someone to vent to if you not find a solution. If you're feeling overwhelmed, you need someone to speak to. If you feel that I need a career change, I need someone to speak to. If you're feeling misunderstood, you have to have someone to speak to. If things are not okay at home and parents are putting pressure on me, I need somebody to speak to. Sometimes, most of the time, we overlook mental health so much because we're so used to Uguti. If I'm sick, I go and see a doctor. But what about if my heart hurts? What about if my mind is not giving me rest when I need to rest? What about if my mind won't shut up sometimes? What about if I feel like I'm going to explode because I'm undergoing so much? So, as you guys can see, almost each and every, actually 97% of the people in this room need someone to speak to. It's not because you're normal, it's not because there's something wrong with you, but that's just life itself. We shouldn't have to be so used to going through life on autopilot because I had to go to class and I go to class and I don't quite feel like myself. So hence why everyone is here, hence why we still put all of this together. You guys have a brilliant job, by the way. But the whole point of it is so that you guys know that there are certain things that I simply don't have to live with. I simply don't have to put up with. Sometimes I even make an example of Yoguti. At home, and if ever I want to ask for something, type of thing. That is a maladjustment on its own when it comes to parenting. Sometimes our parents don't even know how to parent us right or in the way that we need. And that is exactly what counseling, therapy, and mental health professionals are here to do, to basically assist and lend you a hand so that the struggle or bonus is cool in your mind isn't necessarily as big in reality. So there is now, quite a lot, everything that I'm saying now is directly off of my heart, because about depression, about anxiety, about ADHD, about substance abuse. But I think I want you guys to absorb the magnitude and the meaning of mental health in seeking help if I'm not okay, or if the next person is not okay. There are facilities like Abo Famsa, many of them which you can actually get counseling and therapy absolutely free of charge. There's also a cloud therapist which is private. However, the school, I'm certain, can be able to assist you guys with money so that you get the help that you need. Because you do not have to carry the burden alone. So that should be all. I'm going to give because I'm sure I don't know those finances. So, yeah, that should be all. Should you guys need any help? Should you need anybody to speak to? Should you need someone to intervene in the situation at home? Cloud therapist is there definitely for that. We're just going to formulate and see with your school management to see how can we actually be here to lend a hand to you guys. And everyone is putting your hands together explicitly for you guys, because it's a black excellence. So, since I'm also speaking on black excellence and whatnot, I want us to say an affirmation. So, an affirmation is a way of umuntu ukuthi atholishe umqondo wakhe. By total, I mean you trick your mind to believe in a certain thing. And by your mind believing in that, you're actually going to be able to live your life in the way that you tell your mind. So you are telling your mind, listen, I'm in control, and this is how we're going to do it. Okay? So I'm hoping that you guys are going to participate. Mindset is what actually helps you to attain all your goals, to do whatever it is that you want. Because if you tell yourself, I'm a failure, what's most likely going to happen? You're going to fail. Okay? So my mental health and mindset are basically along the same stream. So as you guys are I want us to say an affirmation which I'm hoping that you guys can adopt in life going forward. Everything that you're going to be faced with. So remember these words and possibly say them every single morning, say them every single time before an exam. Okay? I'm going to say something, it's going to be a question, and then there's going to be an answer that you guys are going to regurgitate back to me. Okay? So how affirmations work, or how this one particularly works, I'm going to ask you, who are we? And you guys are going to respond to me and say, black excellence personified. And then I'll ask you, what do we want? And then you're going to say, we want a bright future. And then I'm going to ask you, when do you want it? And you'll say, now. And then I'm going to ask you, how will you get it? And you'll say, by any means necessary. If you have to shout at the top of your voice, you shout. Because with these words, you can literally break through any possible situation. So, I'm hoping you give me the same energy as when we were dancing in this affirmation. So I'm going to ask you, who are we? And you guys are going to say, black excellence personified. Who are we? Black excellence personified. What do we want? We want a bright future. What do we want? We want a bright future. And when do we want it? Now. And how will we get it? Exactly, so I want us to now develop some sort of a rhythm when it comes to that so that it sticks in our mind. Yeah? Who are we? What do we want? And when will you get it? Now. How will you get it? Stand up and say it, guys, so that you show me that you believe it. Who are we? Break down those to get your right direction. So let's say one last time. Who are we?
to cloud therapy for that very therapeutic session. Siyabonga kakhulu, thank you very much. May we please now move on. Thank you guys, you may be seated. May we please now move on to Miss Fuzile, who's going to talk to us about just a short talk on anxiety and depression coping mechanisms. It's going to be a very short talk. May we just put our hands together. Thank you. Thank you.
Good afternoon. Greetings, Moroe Sunrise. Yes, I'm fine. I think I pressed something. All right. My name is Nokuwonga Fuzile, and I'm a registered counselor by profession. I am pleased to be here today. Okay, so I'm so grateful for the speakers that came before me, because now I'm only gonna be here for 2 minutes, then I'm done. They've already covered anxiety and depression, so I won't dwell much on that. I'll just touch on coping mechanisms briefly and then stick to life skills and just a little bit. All right, so Dr. Mube, if I'm correct, she did educate vastly on anxiety and symptoms, how do you see it, and what is it that you're not supposed to do, and where to find help. So I'll just throw a few things that you can also do in terms of coping, and then I go to life skills as I've mentioned. One of the things that you can do, remember there's always a list, and there is no blanket approach or there's no one size fits all. But then so it's always best to know yourself and use what we call is safe, or take what works for you, because investments in Makelwan might not necessarily work for you as well. Okay, so I saw how all of us were rejuvenated by music, so Umculo does have that effect. So it is one of the things that you can also do. Listen to music of your choice. If you enjoy hip-hop, gospel music or whatever, then do that when you go through these things that were mentioned earlier. And it's also important to just look at the positive outcome that you want, because now we are here because we're also here to prepare you and to help you as you're going to be starting your examination. So focus on the outcome rather than the challenges that you're going to come across. Focus on the outcome that you want to achieve. So I remember myself years back, I had this vivid vision that one day I will have a car and one day I will drive. But at that time, then I was a driver, and then so I would just imagine it in my mind. But I'm gonna go driver, and I'll pay attention to the drivers on the outcome that you want for your exam, more than the challenges that you think you will come across. Because the minute you focus on the challenges, already your mind is stolen. Then it's taken by jogi errors and everything else that will hinder you from the success. Okay. And also it's important to distinguish between reality and fantasy. Well, sometimes we allow our mind to be occupied by fantasy, and then that's where sometimes you find yourself overthinking and you do not focus on what is your reality. For example, now, being anxious about a paper that is your reality, and that's true. Then the question is, what do I need to do about it? You study. Then when you have studied, at least you have eliminated some of this that will make you anxious. And I always hear people saying that I've done my best, then I leave the rest to God. So that's what you can do at the moment. So try as much as you can to try and control your thoughts. We were taught how to do the breathing, so I will not dwell on that. It's also important, it's one of the techniques that are important. Just try by breathing. Because when you also breathe, I think Dr. did mention that you allow your lungs to have fresh air. So I will not dwell on that. So I will be skipping. I don't know if there's anyone who's assisting me with projecting. I hope I'm not inconveniencing you as I am skipping the slides, because I don't need to repeat anything. All right, so another thing that maybe we need to just not do is to isolate yourself when you are going through these things. Try to identify somebody that you can talk to. I think it was mentioned, either a friend, but also just do not talk to any friends. I always say when you are about to disclose something, ask yourself first, who do I want to disclose to, for what reason? So it's also important to choose wisely who do you want to talk to and share in the Bible, because the last thing that you want is to share what is bothering you, and then the next thing, okay? Exercising, it's very important to exercise, not just for the fitness, which is the most but it also helps the mood. But I will not really dwell much, but do exercise. Exercising, I think also Dr. Mube did say that you don't have to be a part of a club, even participate in soccer clubs, hockey, whatever that is, but not all of us will like physical exercises. So you can also do poetry, it helps. You can be, what else do they do? Dancing, it's part of exercising. So there are lots of things that you can involve yourself in. Ukuze uhlale in touch with yourself. All right, I've mentioned the hobbies, so I will not dwell much on that. I think I'm done with what I prepared. So now to top it with what I've said, I will also just touch on, which is the life skills. Life skills, that is not just for coping when you go through a situation or something, but it will help you when you go through life, because life, ups and downs is a corner. So it's important that you have coping skills within you. What are those? Maybe I will not exhaust the list, but I will just highlight. One is self-awareness and self-esteem. It is very important to know who you are. What do you want in your life? Have your self-esteem, because self-esteem you have had a rumor about you spreading a scholar, but because you know who you are, it's not going to drive you straight to depression or anxiety. Yes, you might need somebody to talk to, yes, you might need support, but if you have built self-esteem, it's just like when you build a house and make sure that your roof as well as your foundation are strong enough so that the day it floods, it's not that time that you are trying to build a house. So when you work on your self-esteem and you work on, that is your foundation, you work on your foundation, whatever then that comes, it's not gonna sweep you. But I will talk more about self-esteem if one is interested when you're doing the round, because we don't really have much of time. That's one. Two, I want you to also be in control of your emotions, especially anger. People always say that I've done this and that, or some people they are easily angered because abawazi to master or to control their anger. Then sometimes we use that as a friend example, as a weakness. We know that if you have said to Spanbani and you get the results that you want. But then imagine now if they say and you do not react as they expected. Who is winning in that situation? So it's important that you work on your anger management, you master it, you know how to calm yourself through the breathing and everything, so that abantu bangasebenzisi for their own agendas, okay? Then it's also important to be somebody who practices communicator. Not all of us are confrontational people, and not all of us will have to be confrontational when we call this listeners time. But communicating is expressing so that ungaziboni shortness of breath, and it's because you have internalized so much of izinto that are not sitting well with you. So communicator also need to offload or to share. It does not need a group of people. It does not need to who's confrontational, as I've said. You can speak to one or two people, others or just to offload. Sometimes even if they don't say anything back. So that is communicating, including communicating with our families. I'm sure you can choose one person amongst your siblings or parents that you can communicate with. One of the things is to have boundaries. Boundaries in short and long of it is just being able to say no when you have to say no, yes when you have to say yes, and also have limits when you have to set limits. So now we know that we're going to be starting our exams. Not all of us sifunda ngendlela efanayo. Khona abantu who benefit from the group, kukhona abantu benefit from learning when befunda bodwa as individuals or in pairs. Then do know yourself. Remember I said self-awareness is important. Then because you're not going to benefit from the group, do not be scared to say no guys, I'm not going to be part of you. That is having a boundaries. That is being able to say no. No, I'm not going to be able to cross night because my mathematics is cross night, so that is so forth. If you know that does not work for you, then be able to say no, so that it's also going to benefit away. Then having limits is to, if you say, let us go out, and you know very well that by 2 o'clock when you need to be back early so that you can study. So communicate that and say, yes, I will go with you to McDonald's or whatever, but by 1 o'clock I will excuse myself because I have another appointment with myself or with whatever. So that is having boundaries and it's important. So I'm just going to wish you all the best and I will leave the, thank you so much, over to you.
Siyabonga kakhulu, Sikuzile. Next, we would like to have Ms. Ngadi. She will also be very brief as well. She will also be discussing issues on mental health. I think she's coming, she's making her way now. Okay, let's give her a few minutes. May we please give her a few minutes? All right, guys, let's stand up a little bit. Right, guys, so when we were in school, because I was also, so we do. Right, okay, guys, just quick. As they are preparing to have the entertainment after this, we're going to omit the next speaker for the interest of time. Right, okay. So when we were in school, we used to have this sports day, and we were divided into different sports houses, and we used to shout. We would have our sports master scream out, say, in your case it's Anton LEMBEDE. So when I say, give me an A, Camararo, then we say A. No, not me now. You mean A as an alphabet, the first alphabet for ANTON, okay? Yes. And then when I say, give me an A, Camararo, A. Because I want you to be a bit lively, okay? Right, okay guys, let's start. I'll try to be as loud as I possibly can. Okay, are we ready?
I wish you could see you from my eyes just this one time. You've been taught that it's your reflection that you use as a tool for constant correction. It's almost like an obligation to your closest imperfections. You try, I see deception diverging into depression. You're trying to fix what's already perfect. I've never seen someone who writes finished. I never understood color being painted on a finished canvas. Never trusted the changing leaves.
Be proud of yourself. If all you did today was open because when you stay for yourself, you find your limits. Thank you.
Thank you so much. Right over guys and settle down. Our very last speaker, promise. Our very last speaker, Ms. LEMBEDE, will speak on substance abuse. Right, may we please give her a clap. Thank you so much.
Good day, everyone. Thank you for being such a live audience. Please can you give yourself a round of applause? I would like to greet the principal, the deputy principal, the HODs, all the teachers, all the staff members, and my colleagues from the various departments, and everyone who's here. As the MC said, I am Ms. LEMBEDE and I'm a social worker. I'm going to talk about substance abuse, right? So I'm going to use the word substance abuse and the word drug abuse interchangeably, okay? Because it's one and the same thing, right? Okay, so I won't be long because my colleagues have already mentioned most of the things that I have prepared. So I'm just going to be brief, okay? Alright, so the main question here is, what is a drug? Who wants to try and tell us what is a drug? What is a drug? Okay, your hand is up. You want to try? Okay, let me rescue you. It's okay, let me rescue you. Okay, I'm going to read from here, right? Please pay attention. Alright. A drug is any chemical substance that changes the physical, mental, or emotional state of your body. We got that? Okay. So a drug is not just liquid, but that's a chemical substance, which means it must be something you can handle or you can touch. Okay? We say it's substance because why substance because it's something you can stand. Okay. So now that you understand what a drug is or what drugs are, there are legal drugs and illegal drugs. I did confuse everything. Okay. So legal drugs are any substances which are not prohibited by the law. I use the word So other examples of those are painkillers, chronic medication, or the cough mixture. If those things are okay, so those are examples of legal drugs. And then they are commonly abused legal drugs. And that's just one of drug okay, after your chronic medication, against your painkillers, your cough mixture. Alright. Let's talk about alcohol and drug because issues are always against, and it's something that is a chemical against. Alright. So now you're as much as illegal, but it may be abused at times. Alright? Abanye basebenza coping mechanism. They are maybe they're under a lot of pressure, they are stressed out, and they're trying to find a way to cope with the situation. Then they end up consuming alcohol, consuming it excessively, I guess. And alcohol is addictive, just like any other drug, I guess. Alright, so again, that's one of the commonly abused legal drugs, alcohol, and then we have other prescription drugs. Okay, say for instance, you are suffering from flu, for instance, and then prescribe some medication, and sometimes put your medication there is some cough mixture, and then people do some very funny things with cough mixture. You know what they do? Okay, so then they are illegal drugs. I mean, Lawa, they are forbidden by the law. I guess they are not points, but they don't know they are legal, I guess. And then there are those that are illegal, which means they are prohibited by the law. Yes, okay, other examples of those are illegal, ube, amaputan meds, ube, uga, Like how do you tell this one so you can we understand? Okay. So when I was decided this interest in school or work or social responsibility. Okay, we need that something started interest in school because you are learning at it. So we began they loved, instead of the one sport they enjoyed instead of the sport, but all of a sudden that's can't. Their homework or project because they put on the next phase okay, and then deteriorating physical health, chronic tiredness, stress attending, or staying up for more hours, stress about those when happening today, who get it because when they don't have their told, and you are in the best things. And then specific behavior and lying. Who are they looking for a man who doesn't have but you are out on the discussion and we mustn't do that, okay? Sudden changes in social networks. Say for instance, you have friends who are disciplined, all of a sudden you have watch more than the game organized. You mustn't do that, okay? Okay, and involvement in criminal activity. After they end up they end up buying people just because they want cash. So they can afford other drugs that are very okay, and then they always harm you because of the drugs they take, and unnatural conduct. So those are the common signs of substance abuse to look out for. And then there is a link between drug abuse and mental health. Believe it or not, there is a link between drug abuse and mental health. Because other drugs, they cause chemical imbalance in the brain. Yes, I guess? There are chemicals in the brain and it is functioning as a person. And if you take drugs, other drugs that are chemical imbalance, other chemicals in the brain are balanced. Most of the balance development and the result
So I'm not even know. So when I'm supposed to take you must not even start selling drugs. I'm someone that I know, supposed to know. You're living more days. Because okay, I'm curable. Most of that is what I'm saying from drug addiction. Actually, the lab and stuff. But it's a long process, it's not easy. So we're also like your situation rather than the other way. Okay, in case there was one saying again, I hope you're not going to get into kind of trouble, but in case you find yourself saying, when I'm a health line, you're like, I'm not going to see you. When I find a timeline, my never put a time as well, you can take them down, and I so you can just see me at the day after this. So I'm going to timeline, what then I'm going to start or child abuse and stuff like that. Which is South African drug and that and then the content is anonymous. I get anonymous now with their drugs. So you get that this is an organization and it's toll-free line and they're 24 hours, right? 24-hour line, whereby you can contact them anytime and ask for help. And then there's Lifeline. This organization provides counseling, free of charge, the counseling that they provide. So the number on the screen, that's their contact number. And then there's Child Welfare and District, which is a child protection organization. And you can also reach out to them in help. And then there's that Department of Social Development. They deal with other issues that get into global as a whole. And then there's police transportation units. Okay, so in each and every police station, there are specialized units with other child services, other children services. So you can go there and report any child abuse, except for instance you are a victim of domestic violence. You can just go to any section, to any police station, and report any cases of child abuse, and you can totally see on the report. So that is the end of my presentation. I hope you learned something. Thank you.
Thank you so much, Gumede. We really appreciate it. Guys, let's now move to our second session of today's event. So the second session involves you. If you look behind you, you will see that there are stations that have been set up behind you. So we are going to request our form teachers to also assist us. Please make sure, guys, that you answer relevant questions so that we keep time as well. Right? So we would like year 8A will occupy the room. I can see these chairs already set up for you. So all you need to do is to move to station 1. I would like the members of the committee to also assist me as to where's stage 1. My far right or my far left? So stage, okay, far left. Stage 1, so you are going to the projected social work, KwaZulu-Natal Department of Health, social work. You're going there to that station. So year 8A, please swiftly proceed to that station. Right. 8B, we would like you to proceed to the next station that follows that one. You are going to station 2, which will deal with substance abuse. Just again, quickly guys, questions must be stated to the point, and then you get ready to move to the new station. Then station 3, 9A, psychotherapy. I'm assuming psychotherapy will be the third one, directly across me. So 9A, psychotherapy. May you please swiftly move there. Station 4. May we have 10A moving to station 4. Station 4, so you are moving to the psycho, social counseling and social work station.
counseling and social work. And then station 5, 10B, you are moving to station 5, you are moving to cloud therapy. So cloud therapy, 10B, cloud therapy. Then the last station 6, 10D will be going there, and they will